Communities are going beyond the government response to make coronavirus preparations on their own, especially when it comes to vulnerable populations in schools, hospitals, nursing homes. So David Begnaud is at Hebrew Home, which is one of New York's largest elder care facilities. David, we know that pretty much anyone can catch the virus, but the way your body responds really depends on your immune system. But we are learning now that the very old are more likely to die if they do catch it. So this must be so important to the people there.
Yeah, listen, I was just listening to the story our colleague Jim Axelrod did, and it's scary. I mean, that's sobering if you listen to that expert. The reality is where we are right now at the Hebrew Home. The CEO of the facility told me yesterday, let's be responsible and kind of pump the brakes here and not be alarmist at this point in talking about how we're going to prepare. We came here because this is one of the largest elderly care facilities in New York State. They've got 740 residents, 7 different buildings, and it sits on 32 acres here in the Bronx, just north of Manhattan. So we called them yesterday saying, because you guys are so big, beyond telling people to wash their hands regularly, what are you doing to prepare? What does it look like, sound like? And so they invited us inside to take a look.
Gowns, gloves, masks, and definitely monitoring.
Hebrew Home at Riverdale has 180 nurses on staff, plus 6 doctors with an on-site emergency response facility.
It is really incumbent upon us to really be vigilant.
CEO Dan Reingold says their prevention plan includes informing visitors.
If they do feel any symptoms whatsoever, they should not come to visit.
Do you have a way to test for coronavirus?
No, right now the only way that people can test for the coronavirus is, it used to be just through CDC. Now the New York State Department of Health has adopted a testing mechanism.
New York's Governor Andrew Cuomo has confirmed that the federal government is allowing his state to conduct testing for the virus.
I would like to have a goal of 1,000 tests per day.
Crews are heavily cleaning New York City's subways, scrubbing all of the stations, train cars and buses every 72 hours. Schools across the United States are on high alert.
They're doing research on this, and so our children are safe.
This school in Little Falls, New Jersey, is disinfecting 4 times a day. Tracy Marinelli is the superintendent.
We have all the preventative measures in place, the hand washing, the cleaning.
Throws a bullet to Kuzma.
Even the NBA is taking precautions, suggesting players used fist bumps over high fives with fans and maybe take a break from signing autographs. But Celtics point guard Kemba Walker says,
I'm still going to sign some autographs, of course, but I don't know, maybe I should walk around my own market or something.
All right, so that's pretty
fair enough.
Yeah, yeah. You know, I know there's been talk about not allowing crowds in some of these stadiums and stuff, but I think, you know, the thing about the coronavirus, right, is that scientists are really just kind of discovering more and more about it. And I can't imagine what it takes to sort of make sure a facility is clean enough that all the surfaces are clean to make sure that this virus can't be spread. Can you tell us a little more about the cleaning expansion efforts?
Yeah, and that's a really good question, Anne-Marie. And I think in answering that, understand that the answer is pretty basic. And the good thing about a basic answer is that it's relatable to all of us. So the CEO said yesterday one of the things that they're doing is as they go throughout the facility, and I mean everywhere. Remember, there are 7 different buildings on the 32 acres. They're actually using bleach to clean the facility, right? We all got bleach at home. We can do that. This is nothing, you know, that you have to go out and buy from some specialty place. This is something that they are doing, bleaching everything from the railings to the door handles to the medical equipment that they're using. Simple and easy, and you can get it anywhere.
And so how long are they going to be doing this for?
Well, I don't know. That's a good question. I mean, the reality is they are in conversation with the health department and the CDC regularly. You know, you have a half dozen doctors who work on the property here, right? So imagine that. I mean, these people are well cared for. More than 150 nurses, 7 different doctors here at the facility. And I think what's also important that we need to say is we need to understand the lanes that we're in and not try and get out of our lane. So what I mean by that is I'm a journalist. I'm not a medical expert. So in doing stories like this, what we all want to be careful about is is we're going to tell you what the doctors are saying, and we're going to tell you about how the people are responding. I think right now there's a real appetite for some balanced coverage, which includes a balanced tone, right? Because people are worried. Again, that Jim Axelrod piece that I heard earlier, which is the first time I've heard it, that is frightening when you listen to that, right? But how do we put projections and estimations that could be frightening in a respectful and responsible tone? And I think that's something we're all trying to balance right now.
Yeah, I think you're right. I think sort of the tricky thing for us is we want to deliver the information as we're getting it as quickly as possible to the audience.
Right.
But and even for the scientists, they're really just learning about the way this virus works and who's the most susceptible and all that sort of stuff. So it's kind of like it's reporting as the information is unfolding in real time. But I want to ask you about the NBA suggesting that players do fist bumps and maybe they hold off on signing autographs. How are players responding to this? Are they taking up those suggestions?
They are. I mean, you heard the point guard there say, listen, I can get my own marker. I'm not going to start signing autographs. There are other players who are already taking their precautions and kind of backing off, right? Basketball players are all too happy to do a fist bump or a little elbow. In fact, when I got here to the facility yesterday, I went to put my hand out to shake the CEO's hand, and he gave me an elbow. And I said, okay, we can do elbows. And listen, it's not a bad idea moving forward, right? Because if the key here is to wash your hands and thereby protect your hands, do a fist bump, do a shoulder bump, do whatever kind of bump you want to do, but let's try and, lessen the handshakes. And lastly, to your point, even when we were around the doctors yesterday, it is clear to me that even though they went to medical school, they are taking direction from the health department and the CDC. And doctors around the country are trying to talk to each other to collaborate. There's a lot that doctors don't know, even in terms of how to treat patients who have it. And so they're learning, how did the doctors in Washington State treat that patient? How are the doctors in New York City treating the patient who came back? So there's a lot of learning yet to be done. So just know that in all the reporting we're doing, we're interviewing doctors who in many cases are getting information by the day, up to the minute.
Yeah, it's so true, David. Thank you so much for some very level reporting on the topic.